There's a question that almost never gets asked in a doctor's office, and it might be the most useful question in all of preventive health. If someone could sit across from you right now and say, based purely on your biology, here is the most probable way your body will begin to break down after the age of 60, would you want to hear it? Almost every person says yes. And then almost every person spends the years that follow completely ignoring the precise information that had the power to change what happens next. That is not weakness. That is a pattern. And recognizing the pattern is where everything begins to shift. Here is something that years of work in preventive medicine keeps circling back to. Most people are already holding a piece of biological data they have carried since the day they entered the world. It might be written on a document buried in a filing cabinet, printed on an old hospital discharge form, or listed somewhere in a medical record nobody has opened in 20 years. It is your blood type. And before you assume this is going in the direction of fad diets or personality profiles based on your antigens, stay with me, because this is not that conversation. This is about what large-scale population research, the kind that tracks hundreds of thousands of people across multiple decades, has quietly and consistently revealed about how your blood group shapes the way your cardiovascular system ages, how well your brain holds its structure under pressure, how your immune system responds when it is genuinely tested, and what biological pathway is most statistically likely to cause you serious harm if you never examine it with any real attention. What follows is a careful walk through each of the 4 major blood types. For every one of them, there is something that your physician has almost certainly never connected for you in a standard appointment. Not because the information is being withheld, but because a 15-minute checkup was never built to have this kind of conversation. So let us have it properly right now, and stay through to the very end, because there is one final variable that overlays every blood type, a modifier that meaningfully shifts your personal risk picture in ways that almost nobody ever stops to consider. We begin with the blood type carried by nearly half of all human beings on Earth. For the vast majority of human evolutionary history, that prevalence was almost certainly a significant survival advantage. This particular blood type appears to have developed in our earliest ancestral communities, forged in environments that demanded physical stamina, a strong resistance to parasitic disease, and a digestive system capable of handling substantial quantities of animal protein under difficult conditions. What that ancient biological design looks like inside a body that has reached and crossed the age of 60 is worth understanding in careful detail. From a cardiovascular standpoint, people carrying this blood type tend to circulate lower concentrations of a clotting protein known as von Willebrand factor. When clotting activity runs lower, blood moves more smoothly through the vessels. Platelets are less inclined to cluster together, and a statistical likelihood of the arterial blockages that produce heart attacks and blood flow-restricted strokes drops meaningfully. Several large population studies have confirmed that this cardiovascular protection is real and that it represents a genuine advantage over other blood types. That is worth acknowledging without reservation. But here is the part of the story that almost never gets told, and it is the part that matters most for people in this group who are moving through their 50s and 60s. That cardiovascular advantage can quietly become a trap. When your heart numbers look fine and your blood pressure is manageable and there is no family history of cardiac events, it becomes easy to feel structurally protected. And when you feel protected, you stop watching. You start dismissing fatigue as nothing significant. You wave away digestive discomfort as a minor inconvenience. You push through joint pain and attribute everything to ordinary aging. The problem is that for this blood type, the most serious age-related vulnerabilities have nothing to do with the heart. They originate in the digestive system, specifically in the stomach. The lining of the stomach in people carrying this blood type expresses surface proteins that a bacterium called Helicobacter pylori finds considerably easier to bind to than in any other blood type. This organism does not behave dramatically. It does not produce sharp, immediate pain in most of the people it colonizes. Instead, it moves silently into the gastric tissue, establishes itself, and then over the course of years, and sometimes decades, it gradually dismantles the protective mucus lining of the stomach wall. When that process goes undetected for long enough, the progression moves from chronic gastric inflammation to peptic ulceration to, in a genuinely significant percentage of cases, gastric cancer. And gastric cancer that is not identified until it has progressed is among the most difficult cancers to treat with favorable outcomes. Beyond that, documented evidence shows this blood type carries a measurably higher risk of peptic ulcer complications severe enough to require surgical intervention compared to people with other blood types. If you carry this blood type, if you're over the age of 55, and if you have never been specifically screened for H. pylori, that is the single most important medical conversation to initiate this year. The screening is inexpensive. It is non-invasive. It can be done through a simple breath test or a stool antigen test. And for this blood type, requesting it is not anxious over caution. It is precise, biologically grounded prevention. The practical daily approach for long-term health in this group centers on a few consistent commitments. Anti-inflammatory pain medications, the kind that includes ibuprofen and similar compounds, should be limited to genuine medical necessity rather than routine use. These medications erode the gastric lining across all blood types, but when they land on tissue that already carries elevated biological vulnerability, the compounding effect is more consequential. Fermented foods deserve a regular place in the diet. Naturally fermented vegetables, kefir, miso, and similar foods are not dietary trends for this group. They are functional tools for maintaining a gastric environment that is less hospitable to bacterial colonization. And because this blood type is linked to higher baseline levels of dopamine and norepinephrine, the nervous system in these individuals runs on more stimulatory chemistry than in other blood types. When that neurological energy has no consistent physical outlet, it transforms into disrupted sleep, chronic restlessness, and over time, a dysregulated stress hormone profile. 30 minutes of walking daily and 2 sessions of resistance training each week will accomplish more for long-term metabolic stability than any combination of supplements currently on the market. The cardiovascular resilience is inherited. The stomach requires consistent, active stewardship. Moving now to the second blood type. And this is where the distance between what most people know and what they genuinely need to understand is the greatest. This blood type developed as human populations shifted away from nomadic hunting and into settled agricultural communities. Denser populations, more intricate social structures, and exposure to a wider variety of infectious agents all placed new demands on the immune system, and it adapted accordingly. People carrying this blood type mount strong, precise immune responses, particularly against viral threats. Earlier in life, that is a meaningful biological advantage. But the same characteristics that serve this group so well in younger decades begin creating different pressures as the body moves through its 60s and beyond. This blood type carries elevated coagulation activity compared to others. The platelets are more adhesive. The clotting proteins are more activated. A major longitudinal study that followed close to 90,000 adults over a period of 2 decades found that people in this group carry a statistically higher risk of coronary heart disease than those in the first group discussed. What makes that finding clinically significant is not the number itself in isolation. It is what happens when persistently elevated stress hormones interact with that stickier platelet activity over the span of years and decades. The compounding of those 2 variables together over time is precisely what converts a modest statistical difference into an actual cardiac event. The deeper mechanism involves cortisol. This blood type maintains the highest resting cortisol concentrations of any blood group. In short, purposeful bursts, cortisol performs useful functions. It sharpens cognitive focus, mobilizes energy reserves, and prepares the body to meet a genuine challenge. But when cortisol remains elevated not for hours, but for weeks, for months, for years, it does something very specific to the architecture of the vascular system. It inflames and progressively stiffens the endothelium, the delicate inner lining that regulates blood flow across every vessel in the body. And when that lining becomes inflamed and loses its elasticity, it transforms into a surface that's sticky, overactive platelets are far more likely to adhere to. The elevated clotting tendency of this blood type and the chronic cortisol-driven endothelial inflammation of its physiology do not function as two independent risk factors sitting side by side. They form a self-amplifying cycle where each element intensifies the danger of the other. For anyone in this group, the practical implication is this: managing stress is not a quality of life preference or a wellness hobby. It is direct cardiovascular medicine. It belongs in the same clinical category as blood pressure treatment and cholesterol management because physiologically it is acting on the same underlying mechanisms. Checking blood pressure every 6 months rather than once annually is not overcaution for this blood type. It is clinically appropriate monitoring. Asking a physician to include homocysteine levels in a routine blood panel is worth doing. Homocysteine is an amino acid that, when chronically elevated, actively degrades arterial walls, and this blood type trends toward higher levels. The corrective intervention is straightforward: sufficient folate, vitamin B12, and vitamin B6 through dark leafy greens, eggs, legumes, and lean protein sources. Not complicated, not expensive, but specific and meaningful for this group. And establishing a daily cortisol-lowering practice that happens before the demands of the day take hold is not negotiable. 10 minutes of controlled breathing each morning, inhaling for 4 seconds and exhaling for 6, practiced with genuine consistency, produces measurable effects on cortisol regulation in clinical research. 5 minutes every single morning delivers far greater physiological benefit than an hour of stress management practice done once a week. It is the repetition, not the duration, that changes the hormonal baseline. The third blood type carries perhaps the most underappreciated story of all 4 groups. It emerged among nomadic populations who ranged across the vast interior landscapes of Central Asia, people whose survival depended on constant adaptation to new climates, new food sources, and new infectious pressures encountered along the way. The immune system that developed under those conditions is genuinely impressive in its metabolic flexibility. People carrying this blood type can process a broad variety of dietary proteins, fats, and carbohydrates without the inflammatory friction that other blood types sometimes generate in response to dietary variation. That adaptability is real, it is documented, and it represents a genuine biological asset. But here is the clinical reality that most people in this group are carrying without awareness. This blood type presents a distinct immune signaling profile, one that research has consistently shown produces stronger systemic inflammatory responses when exposed to specific inputs that define the modern food environment. Refined seed oils, ultra-processed foods, high-fructose corn syrup. For this blood type, these are not simply poor nutritional choices in the general sense. Research identifies them as particularly potent activators of low-grade systemic inflammation, the kind that operates below the threshold of obvious symptoms for years, quietly eroding immune precision without ever producing a dramatic signal that anyone would connect to a dietary cause. C-reactive protein, a standard inflammatory marker that appears on routine blood panels, should be monitored at least once per year for anyone in this group. A consistently elevated CRP reading above 1 milligram per liter in the absence of an active infection is a meaningful biological signal. It indicates that the immune system is running in a state of chronic activation, and identifying what is driving that activation before it compounds over additional years is the most valuable preventive step available. For physical activity, this blood type responds more favorably to sustained moderate-intensity movement than to repeated high-intensity training cycles. Swimming, cycling, hiking, and consistent daily walking maintain the inflammatory baseline far more effectively than training approaches that generate sharp post-exercise spikes in inflammatory markers followed by prolonged recovery windows. The goal for this group is a steady, well-regulated immune system, not one that swings between extremes. The fourth and most evolutionarily recent blood type in human history appeared when populations carrying 2 of the previously described types began intermingling at significant scale. Because of that dual inheritance, the immunological profile it carries is genuinely unusual. On one side, it absorbed the immune tolerance tendencies of both ancestral types, which translates into a meaningfully lower risk of certain gastrointestinal pathologies compared to other blood groups. That is a real and significant advantage. But the other side of that dual inheritance is where careful attention is required. Because what this blood type gained in immune tolerance, it carries as a cost in neurological vulnerability, and the research documenting that cost has become increasingly difficult to set aside. People carrying this blood type show a statistically elevated risk of cognitive decline, including the form of dementia linked to vascular changes in the brain, compared to the first blood type discussed. The mechanism is rooted in the cerebrovascular system. This blood type inherits elevated coagulation factors from one of its ancestral types, combined with the antigen complexity of its unique dual profile. Over the course of decades, that combination creates subtle but cumulative reductions in blood flow through the brain's smallest capillaries, the microscopic vessels that supply the regions most responsible for memory consolidation, processing speed, and executive reasoning. These changes do not resemble dramatic strokes or visible blockages on standard imaging. They are gradual, microscopic shifts in perfusion efficiency across neural tissue that accumulate invisibly for 15 or 20 years before the functional effect becomes noticeable. By the time anyone connects the dots, the biological process has often been underway for a very long time. For this blood type, cardiovascular health and brain health are not two distinct conversations requiring separate strategies. They're the same conversation pursued through the same interventions. Blood pressure control, blood glucose management, cholesterol and triglyceride monitoring. Every measure that protects the health of the arterial system is simultaneously protecting the cognitive architecture of the brain. DHA, the long-chain omega-3 fatty acid concentrated in fatty fish, such as salmon, sardines, and mackerel, is incorporated directly into the structural membranes of neurons. It maintains membrane flexibility and reduces the neuroinflammatory signaling that accelerates deterioration in the brain's small vessel network. 2 servings of fatty fish each week, or a high-quality omega-3 supplement reviewed with a physician, is not optional nutritional advice for this blood type. It is targeted neuroprotection grounded in specific biological vulnerability that this group carries at a population level. Sleep is the other intervention that cannot be treated as flexible or optional. During the deepest stages of sleep, the brain activates its internal waste clearance system, a network that flushes out accumulated metabolic byproducts, including the proteins most closely associated with neurodegeneration. Consistently sleeping fewer than 6 hours per night meaningfully impairs this process. For this blood type, chronic sleep restriction is not merely a fatigue issue. It is an active acceleration of the very biological process that the blood type already predisposes toward. 7 to 8 hours of sleep every night is not a lifestyle recommendation for this group. It functions as a primary neurological intervention, one that no supplement or prescription can replace. And now, the variable that almost no discussion of blood type ever includes, and one that changes the picture for a meaningful portion of the population. The positive or negative symbol that follows your blood type letter. Roughly 85% of people are Rh positive, meaning they carry the Rh antigen on the surface of their red blood cells. The remaining 15% are Rh negative, and that distinction carries real biological weight. Rh-negative individuals appear to carry a modestly different cytokine signaling profile, meaning the molecular language through which their immune system communicates is calibrated differently than in Rh-positive individuals. The full clinical significance of this difference is still being established through ongoing research. But what is emerging consistently suggests that Rh-negative individuals may carry heightened sensitivity to certain inflammatory triggers. Regardless of which primary blood type letter appears on your medical record, if you are Rh negative and managing any form of chronic inflammatory condition, every anti-inflammatory practice discussed here applies to you with even greater relevance and should be pursued with greater consistency and attention to detail. For women who are Rh negative and are either pregnant or considering pregnancy, where a partner may be Rh positive, this is a medically critical conversation to initiate with an obstetrician without delay. The incompatibility that can arise in this situation is entirely manageable with appropriate and timely medical intervention. What it is not manageable without is that intervention, pursued proactively before it becomes necessary in an emergency context. Know your complete blood type designation, the letter and the sign together. Verify that your physician has both recorded and that both are part of your active medical file. Here is what matters most, and it is the thing that every conversation about blood type risk ultimately has to arrive at. The statistics documented in peer-reviewed research are real. The biological mechanisms are well established. The elevated risk profiles are genuine, and they apply at a population level across all the groups described here. And none of them represent a fixed outcome. None of them are destiny. The distance between a genetic predisposition and the actual health outcome that a person experiences over a lifetime is not a narrow gap. It is an enormous space, and it is filled entirely by the choices made consistently across years and decades. People carrying the highest statistical risk profiles for cognitive decline have been observed in clinical practice maintaining sharper cognitive function in their late 70s than colleagues 10 years their junior. Not because their biology somehow differed from the research populations that identified the risk, because they understood specifically what their biology was working against, and they constructed their daily habits around meeting that challenge directly. They protected their sleep with the same seriousness they would give a medical prescription. They ate in ways that supported the specific vulnerabilities their blood type presented. They monitored the markers that mattered for their group. They kept engaging their minds with genuinely demanding material rather than passive consumption. They brought what they knew about their biology into every small decision they made. And over time, those small decisions accumulated into an outcome that diverged meaningfully from what the statistics alone would have predicted. The risk profile did not disappear for those people. The statistical vulnerability remained present. What changed was the relationship they chose to have with that information. They looked at the map honestly. They took it seriously. And they moved through the years that followed with a clarity and intentionality that made the biological odds increasingly irrelevant to their daily experience of being alive and well. Your blood type is a piece of information. What you do with it from this point forward is entirely yours to determine. The body you inhabit has carried you across every year of your life so far. It has absorbed every challenge you have given it, every season of neglect, every period of genuine care. It has done this quietly and without complaint for decades. Understanding the specific ways it is vulnerable and responding to those vulnerabilities with consistency and precision is perhaps the most meaningful form of respect you can offer it. Not because the science demands perfection, but because the gap between knowing and doing is where health outcomes are actually decided. And that gap belongs to you.